Dr. Naresh Trehan is also with us, of course, Medanta. Thank you for joining us, Dr. Trehan. Just your first comments on this budget, because we are still trying to see, specifically when it comes to health, what the numbers are. I think Sanket had found some numbers which seem to suggest that there's not been a very significant jump from last year.
Yeah, I just found out myself because the finance minister did not mention it. But in the budget document, there is a 16% increase from 64,000 crores to 88 or something like that. So it's not a significant amount because, you know, we are so underfunded for healthcare because we are talking about 1.2% and then it needs to go to 2.5% ASAP. So from that point of view, not a significant thing has been done. And overall, there was very little to talk about except those three things, which is one, that skilling will help. The skilling movement of increasing the outlay and the fact that it can all be digital is also going to help the healthcare sector because we are very intense employers for that segment of skills. The second thing is that we have the National Health Registry will definitely help because that by itself will let us know where the whole healthcare delivery system, the support system is adequate and where it's not, so that it will help hugely in the planning and also integrate the whole system. The third thing was that the mental health portal, which was an important step in the sense that many people have suffered during this long 2 years of pandemic. And these pandemics are not going to stop. I mean, these are just rollover effects. We'll see some coming down the pike soon. So on one hand, we believe that the healthcare structure, although we fought the 2 years of COVID waves quite well, we still need to enhance it and actually strengthen it. So there are 2-3 things that we had requested the finance ministry for, which have not been addressed yet, at least. And one of them was the fact that health sector should be put into the national priority segment, where we can access funding for establishing the rest of or extra. All of us have that ability to go to tier 2, tier 3 cities that we could get access funds at a reasonable rate. The other thing was that there is a gap funding request also in areas where there is low income levels where it will be difficult for healthcare facilities to survive. And the third thing that we were asking for is, which is even the most important of the lot, and it would be revenue neutral to the government, is the readjustment of GST. We as healthcare providers had requested the government a few years ago that the patient should be exempt from GST so that the burden on him does not increase. But what has happened is that we have to, as providers, we have to pay 18% on all the inputs that we get. So that it means that there is a mismatch there. Although the patient doesn't pay, but the cost of delivery becomes higher. And then they have to pay for their insurance premium, they have to pay 18% GST. So what we had proposed was either make healthcare a zero GST so that even the inputs we don't have to pay GST on, or put a small charge on the patient, 3 to 5%, which will enable us to do a set-off. And the second thing would be you can deduct that from the insurance premium so that it becomes neutral to the government. So it's not been addressed. I know it's a complex subject. Hopefully, we'll continue with our inputs on that and the government will respond. But besides that, there is no major big bang change in the healthcare segment of this budget.